Hello, 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 everyone. Welcome to another episode of Sree's Global COVID-19 Show. My name is Sree Sreenivasan, and it's my honor to host this daily, what used to be a daily conversation, weekly conversation around various aspects of the COVID crisis. We're in partnership with Scroll Global and Scroll.in. We're produced by Digimentors. We're so grateful to all of you for being here. This is episode 268, Nurses at Risk. We'll be joined by Teresa Brown, who is a registered nurse and the author of The Shift, One Nurse, 12 Hours, and 4 Patients' Lives, and the writer of a recent New York Times op-ed piece that many people read around the world. COVID-19 is probably going to end my career. Being a nurse was already hard, but in the pandemic, it's become impossible. You'll meet Teresa in just a few minutes. Please stand by. Hi, everyone. I'm Sree. Thank you very much for being here. I'm so grateful to all of you. I'm the Marshall Loeb Visiting Professor of Digital Innovation at the Stony Brook School of Communication and Journalism and the co-founder of Digimentors, a social, digital, and virtual events consulting company. We'd love to talk to you about your virtual events. We do conferences, summits, webinars, talk shows, and we've done events for 50 people and 100,000 people. I bet your event is somewhere in between those two numbers. Just take a look at digimentors.group or just email me. We also want to tell you a little bit about this show. As I said, it used to be a daily program, and we did 250 episodes in 250 days. We had more than 450 guests in 73 cities and 20 countries, including the chief scientist of the World Health Organization. You can find our archives at youtube.com/Sreenet. And big thanks to our producers, Rose Horowitz at Rose Horowitz 31 and Vandana Menon, Vandana_Menon. Please check them both out on Twitter. And we will be getting a chance to talk to Teresa, take your questions. We're live on Facebook, on Twitter, on YouTube, and on LinkedIn. Please hit share right now on those platforms, and you can watch, your friends can watch now or later. You can tag them so that they can take a look now or later, and Teresa will answer your medical questions. So anything you'd like to ask about the pandemic, about the virus, about vaccines, about masks, you can ask her about life in hospitals. She's done a lot of research and really knows what she's talking about. So super excited to have her here and to have you all with us. So our guest again is Teresa Brown, PhD, registered nurse. She wrote One Nurse, 12 Hours, 4 Patients' Lives. The book is called The Shift, and it was called an engrossing human drama by the Wall Street Journal and is a New York Times best-selling book. And she also wrote a recent op-ed that's gotten a lot of attention about how being a nurse was already hard, but in the pandemic, it's become almost impossible. So please welcome Teresa Brown. Hi.
Hi. Hi. Thank you so much for having me.
Delighted to have you here with us. My first question always is, how are you? Where are you? And how's your family and close circles? How are they managing during the pandemic?
Yeah, nice. I'm good. As we talked about, this is my COVID color, the purple.
Perfect match for our colors.
Yes.
Colors, so thank you.
That's my little bit of rebellion against the virus. Makes me feel like I'm kind of owning it a little bit. I'm in Pittsburgh, and I'm good. I'm here with my husband, but our daughters, who's able to work at home, and I'm working at home writing. Our daughters, twins, actually today's their birthday, but they attend University of Pittsburgh, but they're also very careful with social distancing. So we see them about twice a week. So I feel really lucky, as opposed to, there are a lot of people my age who wonder, when am I ever going to see my kids again? And everyone I love is healthy and well. So,
well, that's really good to hear, and glad to meet a fellow parent of twins. My twins are 17 and a half, final year of high school, not a way you want to spend it locked up with your parents.
No, right.
In the Manhattan apartment. But we're blessed and we're glad. And also so good to know you're in Pittsburgh, one of my favorite cities. Nice. And just a great town for a lot of things, including if you love sports.
True. Yeah, and my twins turned 22 today. So
Oh, yeah, that's awesome. So tell us a little bit about how what you've been doing this 1 year. We're kind of building up to the anniversary of the show. March 14th was when we started the show,
oh
and we went
wow.
live every single day through December. And what we learned is that everyone has had a different experience during this year. So tell me a little bit about your experience.
Yeah, so we had a long planned trip to go to Barcelona right around this time. And we were visiting friends who were there on a sabbatical and had debated, should we go, should we not go? We decided, well, let's go. And it was while we were there that former President Trump made the announcement that Americans coming from Europe weren't going to be able to get back into the country, which was not the case, but was terrifying. And so we quickly left Barcelona and spent a night in London and then got back to the US. But it was sort of, I've been reflecting on this a lot because it's a year. And it was, I think, kind of a traumatic way to have COVID become very, very real in this scary way, because we were in Barcelona and in Madrid, the rates were going like this, like just shooting up. And everyone in Barcelona was still, oh, we'll eat outside. Like there were no changes at all, and which is kind of Barcelona and cool. But, and then we were crowded into this plane and then crowded into a small room. We got to JFK, and it made the virus real to me in a very concrete way. And then I had been teaching at the School of Nursing at Pitt. That all went online. My husband's the chair of the physics department at Pitt. He went all online. And it's basically been us just finding our way. For a while, we would go for a really long walk every evening along one of the rivers in Pittsburgh to kind of separate the day from the night. We've watched a lot of Netflix. The really nice thing is we've found out that we actually quite enjoy being together a lot. And we've managed to negotiate the space well. So that's been satisfying, the sort of simplifying of life, and it's worked out for us. I'm working on my third book. So in some ways, this is a great environment for a writer because it's all about being inside your own head. That said, I really miss my friends. I haven't seen my mom for over a year. My husband hasn't seen his parents. Wow, I'd really love to go to a coffee shop, be able to go outside and not wear a mask. Normal life. I do miss normal life. And I've stayed in touch with nurses at the front lines, paid a lot of attention to what's going on with them, and tried to be really aware of that. I was diagnosed with breast cancer 3 years ago, and so thought about going back to work in the hospital, and then because of that diagnosis, made the decision not to do that, which I think was the right decision. I mean, I could say I felt guilty, which is true, but whatever I felt was nothing compared to the people actually doing the work. So I don't want to focus on that too much. But I would love to get the vaccine tomorrow, which is not going to happen, and, have life be the way it was.
Yeah, wow, that's a lot of what a year you've had. And,
yeah.
I remember when President Trump made that announcement and the video of all of these panicked Americans at the airport. And so you're saying that wasn't the case. So it wasn't that that it was being locked down immediately?
Americans could still get back into the US, which was always true. He just didn't say that part. But you could come in from Europe. So I very quickly hustled and got us some actually very reasonable tickets to go to London. And then we were able to work around our, American Airlines tickets. But yeah, I mean, it was scary. And then we were looking online and people were paying $10,000 for a plane ticket to get back from Europe to the US because he had said Americans won't be able to come back in, which was not the case. But we only knew because a friend of my daughter's had been texting her, and a friend of my daughter's here in the US, and then finally called her and woke her up. And so, it was 3 a.m, and I'll never forget this. Miranda coming to our room because she'd come with us. She was the only child who was able to come with us. Well, she's not a child, but young adult who was able to come
Always
with
your
us.
child.
Exactly. And her standing in the doorway saying, parents, Trump just said Americans can't come back from Europe. So you can imagine what that was like. It's, the middle of the night in Barcelona, getting online, trying to find tickets. And finally I found, like I said, some really reasonable tickets through Norwegian Airlines. So it was a great experience. I will have a soft spot in my heart for Norwegian Airlines for the rest of my life.
Yeah, I think it's a Norwegian shuttle or something they call.
Yeah.
About children, I have a photograph of one of my trips to India and my father ironing my pants, and he's like, you could be the father of a 47-year-old at that time, and your work is never done. He's always your baby. And so let's talk about your work and this particular essay that you wrote, this talking about nursing and nurses around the country. Tell us about it. We'll just read some of these comments here. Rahajan, who's watching, says, good evening from Long Island. This hits very close to home since I have many in my family who are nurses, and I once seriously considered a career as a trauma nurse. So thank you, Rahajan, for being with us, and I'm sure Teresa is happy to hear that. And everyone, tell us where you're watching from. Ask questions about the virus, about the vaccine, about the pandemic, about masking, about careers in nursing. We hear there's more interest now with people who want to be in healthcare. So we'll talk about all of that. But let's start with the downside of the pandemic and how it's affected nursing really badly.
Yeah, I would say the basic issue is there just have not been enough nurses over time working in hospitals. And there's many factors that go into that. One thing is that nurses in some areas say when New York got overwhelmed, became travel nurses and went to New York because they could make 3 times, 4 times what they were making as a travel nurse, but also have that feeling of I'm helping out, I'm doing my part. I don't think it was just money that was motivating them. So that worked okay for a while, but then when COVID spread more thoroughly across the whole country, there just weren't enough nurses because travel nurses couldn't be pulled from places where COVID was not a problem because it was a problem so many places. And there's been a looming nursing shortage for several years now because baby boomers are aging and they're going to need a lot of healthcare, just like most people do when they, get beyond a certain age. And the average age of RNs in the US is 50. So a lot of nurses are going to be retiring. And then we have a pipeline problem. We don't have enough spots in schools of nursing for everyone who wants to be a nurse. So you put all those together, and then you put on top of that a nursing workforce that is exhausted from taking care of COVID patients, stressed beyond belief because of how physically demanding it has been, but also emotionally. And I tell you this, when I started hearing nurses talking about we need mental health care, that was when I got really concerned, because as a group, I don't want to stereotype, but as a group, nurses, although they would advocate for patients to get mental health care for themselves or for ourselves, it's kind of a, I'm fine, I can do anything, I'm tough, nothing can break me. And so when nurses started saying, wow, we need some mental health support, I thought, this is really serious. And everything nurses are saying suggests they have PTSD, that many of them have passed into a level of burnout that we call moral injury. And it's very hard to come back from those places. I've heard from nurses, been nurses for years, who suddenly found themselves just breaking down on the job, which again is so unusual. I mean, it's so unusual as a nurse to cry at work. It just doesn't happen. I mean, sometimes it can, but so there's just a worry that a lot of those nurses are going to quit. And then we have this pipeline problem. We have this increasing need for nurses, and we're not going to have enough nurses. And without nurses, we can't have healthcare. So what I really want is for there to be the support that nurses need. And just to explain briefly, I went into this in the column, but why it's so hard if you don't have enough, what I mean by have enough nurses. So COVID patients are very sick when they get to the ICU level of care, and they're very fragile. And so one nurse said even having 2 COVID patients is a lot in an ICU. Standard ICU ratios tend to be 2 patients, 1 nurse. And so some of these nurses, though, went up to 3 patients per nurse, 4 patients per nurse. And it's just impossible then to do everything those patients need done, to look out for them in the way they need to be looked out for. And the guilt that comes with that is incredibly difficult. And that sense of moral injury. I came here to help, I came here to make a difference. And I'm not making a difference because I can't be in 3 places at once. It's incredibly, incredibly hard. And I think we could fix this if we would take care of nurses. I think a lot of them have felt like they weren't supported by their hospital. They weren't supported by management. Some did, many did. There were hospitals that did not lay off nurses, didn't furlough anyone, really took care of their staff. And then there were hospitals that fired nurses even while they were taking money from the government to keep them from doing that. So that's the long and the short of it.
Here's a comment from Nurse Jenny, at nurse_Jenny. With COVID-19, nursing students are not getting their clinical rotations in the hospital setting. Can you explain what she's talking about?
Yeah, that's a great point. So usually nursing students go into a hospital floor and do an 8-hour shift or a 12-hour shift. And that's the teaching that I was doing, that when I came back, went virtual. I was teaching at University of Pittsburgh School of Nursing. So you need a faculty mentor, but you're actually in the hospital to the ability that you are able taking care of patients. I mean, the patients still have their own nurse and their own doctors, but it's how they learn. And so if students can't be in the hospital to learn, then when they start their jobs, they're going to need a really, really long orientation to really learn how to do the job. And the problem is that what we're hearing is hospitals more and more, they don't want to do that. They want nurses who can just hit the ground running. They don't want to have to orient people. And so, something's got to give, right? Like, this system is not sustainable. And I was talking yesterday with the president of the American Nurses Association about what they're doing. And because in the column I said, I don't feel like they're making enough efforts to improve nurses' work environments. And, we see how to handle staffing differently. But he said many, many more people are interested in becoming nurses. And that's great. But the problem is we still don't have enough spots for all those people. And I said to him, wonderful, but if these amazing people become nurses and then after a year, the work environment is so destructive that they leave, we haven't accomplished anything. And it's a huge waste of resources to have nurses come in, start a job. 25% of new nurses leave their first position within a year.
Because of the difficulties with it.
Yeah, and it may just be, that they were in orthopedics and they felt like, no, I want to go to oncology, but it's such a big statistic, and it's confusing to me because having nurses turn over costs hospitals money, and yet it doesn't seem like they do a lot of hospitals to prevent that, or to help nurses be comfortable in the job that they're in.
Thank you. And let me just remind everyone what we're doing here. That's our guest, Teresa Brown, and she is at Teresa Brown on Twitter. She's a registered nurse and the author of The Shift, One Nurse, 12 Hours, 4 Patients' Lives. We'll talk about that book in a minute. And she also wrote this amazing op-ed that looked at the situation with nurses and how COVID is affecting their lives and making it even more difficult. And this quote about how it would end one of the nurses that Teresa spoke to. So folks, if you're watching right now, please tag your friends. They can watch live or later, and also post your questions, and Teresa will answer them. So I want to ask you a little bit about how you became a writer. You were obviously practicing. You're also a teacher. You then wrote this. You're working on your 3rd book. So walk us through the books. Yeah.
So I actually have a PhD in English, and I taught English for 3 years at Tufts in Boston, or outside Boston. And then it was really having my kids and really having the twins. So that's why having this interview on their birthday is really meaningful to me, because it was their birth and what I went through in the pregnancy and afterwards, and working with midwives, that made me think, wow, I think I want a really different job. I want a job like this. And then I thought, but I can't be a nurse. I don't know anything about it. And I took all these humanities classes. And then I found out about accelerated programs, which are where someone who already has a bachelor's degree or a master's or a PhD can take the science classes they need and then enroll in a nursing program where you get the courses you need for a bachelor's in nursing. And those can take some places a year, I think some places a year and a half. And, you'd have to look into it. But as soon as I found out about that, I was so excited. And I thought, oh, I can become a nurse. So I started taking science classes, and then ended up going to school at University of Pittsburgh, and started working as a nurse. And I never had regrets about leaving my academic job behind, but I had a very bad experience when I was still a pretty new nurse, and had a patient who was supposed to go home that afternoon actually started coughing up blood and just died right in front of me in the room. And, we called the code, and you run the code and tried to revive her. But
sorry, run the code means? Sorry.
Oh, sorry. Bring in a whole, like on TV when they say, bring in the crash card and it's a code blue, and which is not dramatic or fun or exciting in real life in any way. It's just really sad. So they, people from ICU come in and they try to do everything they can to save the patient, but this patient could not be saved. And as you might imagine, I had a hard time putting that behind me. So I thought, well, I'm going to write it down, because then it'll be on paper instead of bouncing around in my head, which that doesn't really work. But I liked what I wrote. And so I thought, well, aim high. I'm going to send this to the New York Times. And then the Science Times, the Tuesday supplement, they said, well, we're going to take this. And it was that piece that got me my first book contract. I started writing for the Well blog. And I always say, right person, right place, right time, right voice, because what people said to me was, this is a voice we never hear, the voice of a bedside nurse. And that was such a revelation to me. Wow, there's a lot of curiosity, and, having been raised on media that tends to be very physician-centric when it shows healthcare situations, or, who gets interviewed, it tends to always be doctors. not that there's anything wrong with interviewing doctors, but nurses have a huge story to tell about healthcare too. And that was just so gratifying to find out, wow, people would like to know. And I really embraced that as a mission. That's what I called it, a mission to educate the public about what nurses really do. So my first book is called Critical Care. It's really my first year of being a nurse, where, I ended my last shift as a student and then started my job, and that feeling of, oh my gosh, I understand nothing that's going on. I can't do this job. It's way too hard. I'm never going to make it. And then, this is another steep learning curve, right? And then figuring it out. And then The Shift, my second book, is one day in the hospital based on a real day that I had. I was going to say book was a pleasure to write. I'm sure that's not how I felt when I was in the middle of it, but I just have heard from so many people, you nailed it. You really captured what nurses go through, and that makes me feel really proud. But I will tell you about the subtitle, one nurse, 12 hours, 4 patients' lives. My literary agent, who I work with, she said, I don't, 4 patients, 8 patients, what's the difference? I mean, in a nice way, not, then after we talked about it, and she said, wow, I had no idea. And then I did a whole bunch of radio shows when the book came out, and several times had nurses call in and say, 4 patients. I'd be lucky if I ever had 4 patients, just nurses who only ever had 8 patients. And so we talked about that, and it's just, it's fascinating how much variation there is. And I would really like the public to pay attention, because it's really, really important. You won't get as good a care if there aren't enough nurses. You won't. Not because they don't care, but just because people can't split themselves in 2. And I've tried, it doesn't work.
So if anybody's just walking into this conversation, we're talking to Teresa Brown, registered nurse and best-selling author. So you gave up a English department teaching job to take a much more difficult career. You changed your life, you changed your career after you had children. And there must have been many times when you say, boy, I wish I was back in the English department. Yeah,
I don't think I felt that so much, but sometimes I thought, what am I doing? I think I felt like I don't really want to do that job anymore, but it's like, I don't know about this job I chose. Maybe I didn't choose the right job. Yeah. And then, this is a great piece of advice if there are any new nurses listening, because another nurse on my floor she'd started maybe about 6 months earlier than I had. And it seemed like she knew what she was doing. She said, Teresa, someday you're just going to get it. And I thought, no, I'm not. And then one day I did. It was as if all of a sudden there were all these like little tiles, colored tiles floating around in my head, and they just, suddenly made an image, and there was a mosaic that said, healthcare or whatever. But so, you do figure it out.
Well, I'm so glad you did. A couple of points that you brought up, I think, that are important is that we don't hear the voices of nurses enough. This is, partly we see doctors' voices in a lot of places. There are a lot of doctors who write and become best-selling authors, very successful. We've had tons of doctors on the show over the last year. I have a radio show for which we've had doctors, and what I found is that it's actually harder for nurses to get permission to be on shows. So
yes,
doctors are typically have more agency because of the way the medical system works. They're in private practice or they are freelance, and so they control their lives, whereas many nurses, or most nurses, may be attached to a big hospital. And also partly they don't get the kind of media training and things that doctors, it's a kind of chicken and egg,
Right. Yes.
any cliche about this. So there have been multiple nurses who we've asked and invited who've said that they don't get the permissions that the doctors do. And I think, especially at the height of the pandemic, in the early days, they hadn't been given media training, and they may have felt that nurses might be more direct, more honest about, and more transparent, whereas doctors who, because of insurance and all these other things that they get a lot of training around for a variety of reasons, might be more controllable. I don't know if you'd agree. That might be in the back of the heads of the folks who make these decisions of who to put out there. And then let's face it, there's also just kind of bias towards doctors. As in any profession, there are some people who get better pay, get better power, have more power.
Right.
So how would you describe what I just put together there?
That it's very smart, and you're right. And when I started writing, I really was so naive about all of this, because another thing hospitals do is they don't always tell you what the media policies are. Nurses, I mean, I'm sure doctors know that, but so at first my hospital liked me writing, and then after a while they didn't. That's what I say. They liked me until they didn't. Anyway, thank you, Nurse Jenny. She's writing a very nice thing.
Teresa, you're such an inspiration. So very grateful. Our paths crossed. She says, very, very true.
Aw. And at one point, someone in the PR office said, well, we've just given you a longer leash than other people. So there was all this stuff going on behind the scenes that they would never level with me about. Like, no one ever just said, here's what we usually do if somebody wants to interview one of our staff. So that made it hard. And I think that for doctors, you're exactly right. They may have media training. A doctor who is very high up in the hospital hierarchy probably has some ability to leverage that, right? And to say, well, I do want to go on CNN tonight, or I do want to talk to Sree, or, has some power that she or he can wield, whereas nurses don't. And I think that's really hard. And I wish there were stronger whistleblower protections or speaking to media protections. I mean, there have been nurses who've spoken up during COVID. I know there have also been nurses who got smacked down because they spoke up. But we have seen more talking from nurses, more looking at what their jobs are like. And there's certainly nothing wrong with talking to doctors. But I would like it if sometimes nurses' voices got out there. But it's not just that journalists aren't trying to talk to nurses. There are these structural issues. I mean, I can even tell you a funny story. I don't know if it's that funny, but I was speaking at a conference once on end of life care. And we were talking about, if the patient has made their wishes clear, they don't want to continue treatment, but the doctor decides, oh no, we need to continue treatment. And how the nurse can only do so much to speak up for that. And someone afterwards said to me, well, why do you think nurses don't speak up? And it was one of those moments where we were in a room and everybody was talking, and then just suddenly everyone stopped talking, And so, Nurse Jenny says she's been written up for being a whistleblower. Yeah. But so suddenly the room was quiet. And so she'd said, why don't nurses speak up? And I said, because they don't want to get fired. And it was actually a really great moment, because I felt like people were saying to me, you should just say that nurses should. Oh, I'm sorry. My computer's on is falling. Why is it doing that?
All right. Well, there we go. I'll give you a second to fix that.
That's good. Why don't they speak up? Because they don't want to get fired.
Let's talk about one of the things that I feel has happened is more appreciation of nurses during this time. I think it's because nurses are providing that frontline healthcare, and many more people are exposed to that. And I think the media is just much more aware, and we're so glad to see that. So we do salute nurses, and we're so glad and grateful for you and for every nurse that's working every day, not just during these times when the media is paying attention. I think that's important to say. Let's just look at some of the other comments that have come in. Steve Taylor's watching from Philadelphia in your state.
Oh, nice.
And Jonathan's watching from the East Village. He's watched 268 episodes. Every single episode Jonathan's watched.
Wow.
And he has got my first shot on Monday. The nurse who administered the shot told me she was working 6 days a week, 12 hours a day.
Wow.
And, we have these protections for pilots of big airlines. We should be doing more to protect our healthcare workers. And Jonathan, thank you for watching. Let's see. Stefan is watching from Ramsey, New Jersey. Always thinking of all our heroic frontline workers. We're risking it all for our health and safety. Bless them all.
Oh, nice.
And Rahajan is telling us a story he's mentioned before. His late mother, Teresita, was a nurse from 1957 to 2007, primarily working in the operating room. Sadly, she died in her nursing room, in her nursing home last year of COVID-19. He told us how he hadn't been able to see her for several weeks, and then she passed. Rajan, we're thinking of your mother and your family. Neil Parekh, who is on our Digimentors team, is watching from Springfield, Virginia, and she says, thank you for being on our show, Dr. Brown. And we have lots more comments coming in here. Paula Kiger is watching from Tallahassee.
Nice.
For being here. And everyone's wishing your twins happy birthday.
Aww.
So they're not watching on their 22nd birthday. They're doing a TV kind of hit right now.
Yes.
But just greetings coming from all over. And Apollo's watching from Montclair, New Jersey. And we've also shared links to your author page, so teresabrownrn.com, as well as your Wikipedia page and your Twitter, which is at Teresa Brown. So just great to see all of this happening here. And Daryl's watching from Richmond Hill in South Queens, New York City, where the men are handsome, the women are superheroes, and the kids are above average. And and look at this, Rajan is tagging folks, and I think that's great because then they can watch later. Rajan says that Professor Brown, you may know my cousin Jean Baloyo Ruiz, who is an instructor at the University of Pittsburgh's nursing school. She's also a critical care nurse.
I don't know her, but maybe I should.
Yeah,
sounds like I should. Yeah.
Yeah.
Wonderful.
And Bharat is asking, what do what kind of precautions have you taken in your life around COVID, and have you gotten the shots?
I've not gotten the shots. Pennsylvania has been slower than some other states, but we're going to be ramping up. And also apparently the National Guard is coming in, and I can be in that first group. So I'm hoping soon. Looks like we'll probably get the Johnson & Johnson vaccine.
So one shot. Yeah.
Yeah, one shot. Not as effective as the other two in terms of keeping me from getting a mild case of COVID, but would keep me out of the hospital, no ICU, would never get as serious as it can get. So what precautions did we take? We were actually very careful. And we tend to always mask if we go out.
Since you mentioned mask, can we just say double masking versus single mask?
Double masking. I would, if I'm just say walking the dog, I will wear a single mask. But if I'm going to be inside somewhere, I will double mask. And why not? If you're wearing one, it's not really a big deal to wear another one. So, it's such a risk benefit thing. And I know this is such a political issue, which kind of makes me crazy.
Yeah. Why is it political?
Right. But just, you wear the mask, or, what's the worst case scenario of wearing a mask? You wear the mask. And what's the worst case scenario of getting COVID? You die a sad, terrible, lonely death in the ICU. To me, it's not a contest. I have a hard time really getting why this is so difficult. But I tend to be very practical that way. So we've really limited who we see. We see our daughters. And in the summer, we did have friends over to have dinner on our front porch. And we actually put up a fan so there would be like air moving, droplets off of our table onto our neighbor's front porch, of course. And I even several months ago bought an air filter because, we needed some work done on the house. And so, let's just turn on the air filter, even though everyone's wearing masks. I mean, we've barely used it, but it makes me feel better. So
we understand that. What do you make of Governor Abbott in Texas opening every business up to 100% and removing the mask mandate?
I think the first thing I thought, that's stupid, but it's just so disrespectful to all the healthcare workers in Texas who are just knocking themselves out to keep people alive. And I mean, one of the sentences from my op-ed that the Times ended up quoting and bracketing around the column was a nurse from El Paso, from Texas, who said, "It's moral injury when I leave a hospital bursting at the seams and all the bars and stores are full of people." And if people watch this amazing New York Times video called "Death Through an ICU Nurse's Eyes," they talk about how hard it is to work in the ICU. People are dying all the time, and then they leave and there's no masking, there's no social distancing. I mean, obviously some people are doing it, but so I understand wanting to get the economy going, but to me, this is another symptom of how the US has become a kind of hyper-capitalist, this is this new word I'm using, nation, and not the right priorities.
Yeah, I mean, it's really sad that that's the case. Nurse Jenny says, pure ignorance, very disrespectful.
Yeah.
About that. Daryl's got his second dose of the Moderna vaccine. I was told expect some side effects this time. First dose, had a sore arm for 2 days. So that's all worth having.
Yeah.
I think it's really important that everyone who can get the vaccine when they're allowed to. No jumping the line, but definitely get it if you can. We've seen stories of people jumping the line. Someone flew to Dubai to get it from Canada and then lost his job. The head of a major pension system, he was fired because of what he did and things like that. We'll go through we have a few more minutes with Teresa, and let's just look at some of the comments here. She said she never thought this would ever be possible, but since the outbreak of COVID-19, all of a sudden I became the enemy for giving COVID-19 education. It's been rough in Southern California. And this is typical of so many nurses. Along with my nursing job, on my days off, I've been working with core response at Dodger Stadium. And last Saturday, they vaccinated 12,000 people, which is stunning number. And thank you, Nurse Jenny. And thank you for sharing that. One comment off the news, we had President Biden say that there'll be enough vaccines for all 300 million adults or whatever the are by the end of May. But the concern is getting those shots into arms and the shortage of nurses that you mentioned. And so what can we do about that between now and May?
That's a great question. And I wish it were easier to volunteer, because I was going to volunteer to give shots. And then the only way you could do it in Pennsylvania that I found was you were sort of committing to doing a whole list of things maybe. And it was very confusing. And I felt like, no, I don't want to do all that other stuff that has to do with emergencies. I just want to give shots. So I wish there were an easy way for nurses to volunteer, because someone like me who's not working clinically, or a retired nurse, or someone who's working part-time might want to give injections, but it has to be sensible. And simple. I hate to say that, like I'm not going to work hard at it, but it just seemed like it was asking me to commit to more than I felt able to commit to.
No, I hear you. So as we wrap up here, I want to ask you your advice on anyone who's got the opportunity to get a vaccine. How much should they be concerned about which vaccine it is?
That's a great question. And I've been looking into this because me and my husband going to get the Johnson & Johnson vaccine. So the downside of that vaccine is it does not protect as effectively against a mild case of COVID as the Moderna and the Pfizer vaccine. The upside is it's one shot instead of two. And the good news, and I've really just kind of gotten this all in my head, but so this is really, really important. If you remember one thing I said tonight, have it be this, is that all the vaccines offer protection from the worst effects of COVID. I think I already said that, but I really want to emphasize it because it's so important. So it is possible you could get a vaccine and still get a mild case of COVID, or even a case of COVID that feels like the flu, that kind of kicks you around a little bit. But the vaccine should protect everyone from the worst ravages of COVID. And yeah, I understand there are a lot of questions about the vaccines, and people have reservations for all kinds of good reasons and silly reasons, but this is about your life and saving your life. And I really would encourage anyone who can to get the vaccine.
Thank you. I'm just going to do a couple of promotions and then ask you your final thoughts that you'd like to share and where people can learn more about you as well. So let's just tell folks about some of our shows that are coming up. Our friend Stefan Kaplan, who runs Spinach Social Hour, tomorrow, Thursday at 9 p.m. Eastern, is going to be interviewing Tai Chi. He's an amazing photographer, and they share their journey and their work. So please check that out, 9 p.m. on the Spinach Social Hour. And then on Sunday, we host She's on Call, hosted by Dr. Sujana Chandrasekhar and Marina Kurian. They're two surgeons, and they interview women and others and men about various aspects of the crisis. And there's International Women's Day, Trailblazers in Medicine. You see this episode 11 a.m. Eastern every Sunday, and our team produces that, so we're delighted to work with them. And just two more, we also have the Sunday New York Times read along, where we read and talked about Teresa Brown's op-ed in the New York Times. This coming Sunday, March 7th, is Cheryl McCarthy, who is a longtime journalist and the host of CUNY's 1-to-1 interview show. March 14th is Ralph Blumenthal, who's a New York Times reporter for decades. And then Jason Deeren will be with us, an award-winning investigative journalist for the Associated Press and author of Kill Shot, A Shadow Industry, A Deadly Disease. And then also wanted to mention that tomorrow night we have a show that I am hosting for the Asian American Legal Defense and Education Fund, and Juju Chang and Ronnie Chang, who are two big TV stars, will be honored, along with Ann Mukherjee, who's the CEO of the company that owns household brands like Absolute Vodka, Jameson, Chivas, and others. And so anybody who goes to alldef.org, it's a free event. There's an annual event that I co-MC, and so that's tomorrow evening at 7 p.m. Eastern, virtual gala. That's the life we all live now. So if you get a chance, just go to AALDEF.org, and you can check out this program, or at AALDEF on Twitter. Preet Bharara and others will be giving shout outs and greetings as well. So with that, let's get back to tonight's show. We've been talking to Teresa Brown. So grateful that you could be with us. We want to give you a chance to give us some final thoughts.
Yeah, I would say if anyone really wants to know what it's like to work as a nurse, this will sound like a blatant ad, but you could read my book, The Shift. And I'm only saying that because so many nurses have said this really captures what it's like. And this is a time when there's been more public interest and media interest in nurses than we typically see. And so I would say use it as an opportunity. Find out more about nurses. What do they do? Are they going to be the ones saving your life? You know, we think that it's only doctors who pull off healthcare miracles, but it's nurses a lot of the time. So find out more about nursing, and then think how you can support nurses. All kinds of ways to do that.
Awesome. Daryl says at the facility where I got my shot, there was a bottleneck because only one person was doing the data entry. All patients had a 3-form to complete. That's a lot of paper for one person, and they couldn't get tablets to patients, he's asking. Nurse Jenny says, thank you so much for sharing, Teresa. Bob Anthony, who works with us at Digimentors, says, I'm so glad South by Southwest, normally held in Austin, is virtual this year.
Right.
It would have been a global super spreader under the new rules. And Stefan has shared this to Med Twitter. And Rajan has added your 2 books to his wish list.
Aww.
And I'm grateful to Professor Brown and all nurses and other healthcare workers for what they do. Blessings to all of you and your families and other loved ones. So beautifully put, Rajan.
Aww.
Everyone, please check out teresabrownrn.com to learn more about her. Check out her books and also follow her on Twitter at Teresa Brown. Thank you so much for your time today. Super grateful to you.